Recording from our respective locations, I am Matthew Huffman, Public Affairs Director at MCADSV, and this is Momentum, a webcast produced by your coalition connecting advocates across our state. So earlier this year, back in August, Missouri voters passed a ballot initiative to expand Medicaid here in our state. Now that's going to take several months for it to actually get implemented, which is why it's so important right now for those of us in the health advocacy field, those of us in the social services sector, to really be working together so that in summer 2021, our state is ready to go to help individuals and families who really need that access to coverage and care available to them. And it's with that in mind that I'm excited to introduce this month's guest, Sheldon Weisgrau. Sheldon is the Vice President of Health Policy at Missouri Foundation for Health. Sheldon, welcome to the podcast.
Thanks, Matthew. It's great to join you, and I'm happy to be here.
Thanks. Well, I'm really excited to have you join me this month to talk about Medicaid expansion. It's something that our state has worked on for a long time. There was a lot of hard-fought efforts between different advocacy organizations to really get it on the ballot to begin with, and then to see this effort through. I'm also excited to have you talking with us today because normally my guests on the program are either my coworkers, advocates at some of our member agencies, maybe a board member, but I'm excited to have you join me today as a content expert and as an ally in our health advocacy work.
Well, thank you. It's great to be here, and I know that the work that your organization does and that other advocates do around the state on a variety of issues that in different ways impact people's health are so important to all of us moving forward and doing what we need to do. I know we at the foundation are all about addressing health inequities and the causes of health inequities and trying to transform the systems that create those inequities and make changes that enable people and communities to thrive. And obviously, we all have to work together to get there. We do it through a number of different avenues, whether it's funding programs, which is I think what most people think about with foundations, but we also collaborate with organizations. We try to play a role in the policy world. We try to play a role by communicating what we do and communicating issues and ideas to people. And so we work in a lot of different ways to get our jobs done, and working with advocates like you and with organizations like yours is really just a piece of that.
You know, something that you just mentioned is that the foundation really works on collaboration. And I think that that's such a really important piece of Medicaid expansion. And so just being able to think about, we have a lot of players in our state who are really invested in this effort. And I appreciate that the foundation has taken such a really strong stance in being able to help all of us work together to make sure that it is a smooth implementation. You know, before we get too deep into the conversation, I want to just get us started with some basics. So Sheldon, can you talk a bit about what Missouri's current Medicaid program is?
Sure. So Medicaid is a program that dates all the way back to 1965. It was part of Lyndon Johnson's Great Society programs, and it was a companion to Medicare. Everybody knows Medicare as the program that provides health coverage to senior citizens. Medicaid is a program that was designed to provide health coverage to people with very low income. It's not enough, however, to be just low income to qualify for Medicaid. You need to be a member of a group that's eligible for the program. And so you need to be low income and a child, or low income and a pregnant woman, or low income and an elderly person. And if you fit into one of those categories and also meet the income requirements, then you could qualify for health coverage. Medicaid is different in every state in the country, and so Missouri has its own unique Medicaid program. And the political decisions Missouri has made over the years have left us with a Medicaid program that, until expansion, is actually one of the strictest in the nation in terms of being eligible. And so, for example, if you are a parent, you are only eligible for Medicaid at the absolute minimum level that's allowed, which dates all the way back to the welfare reform laws in the 90s, and is equal to about 20% of the federal poverty level. So to give you an example, if you're a parent in a family of 4, you have to have an annual income of less than $5,500 to qualify for the Medicaid program. So you need to be very low income. Some of our other categories, we do a better job. So in terms of covering kids, for example, here in Missouri, kids with income, all with family income all the way up to about 300% of the poverty level are eligible. But just in talking about this gives you a sense of the complexity of the program. Different categories of people eligible at different levels of income, all to create a program that probably doesn't have the reach it needs to really provide insurance to all the people who need it.
So thinking about that a little further in expanding Medicaid and trying to capture more of those folks who are falling in those gaps of needing access to care and coverage but not fully qualifying, what does Medicaid expansion then mean for Missourians?
So Medicaid expansion greatly simplifies the process for a lot of people of qualifying for the Medicaid program. So what it does is it expands income eligibility up to 138% of the poverty level, which is about $17,000 a year for an individual, about $28,000 for a family of 3. And so if you think of that example of the parent I gave before, that a parent in a family of 4 can make no more than about $5,500 a year to qualify. Under expansion, that income eligibility goes up all the way over $30,000 a year. And so obviously a lot more people would qualify for coverage. And the reason that's important is because the changes that were brought about by the Affordable Care Act opened up the private health insurance market to a lot of people that didn't previously have access to it. And the way it did that was by providing pretty generous subsidies to a lot of people to help them afford to buy health insurance. But to qualify for one of those subsidies, you have to be at least 100% of the federal poverty level. And the system was designed that way because originally everybody below that level would be in an expanded Medicaid program. But in 2012, a lot of folks remember the Supreme Court's first decision about the Affordable Care Act. They upheld the whole law except for the part about Medicaid expansion, where previously it had been a requirement, it became an option. And so what that option created in states like Missouri that chose not to pursue it is what we call a coverage gap. We had several 100,000 people in this state who made too little money to qualify for subsidies to buy private insurance, but too much money to qualify for our Medicaid program. And so they fell into what we call a coverage gap, where again, they made too much for Medicaid, not enough to qualify for subsidies. There's the estimate is that there's about 230,000 people in the state of Missouri who would be covered once Medicaid was expanded. And the Missouri legislature and the Missouri governor put roadblocks, legislative roadblocks in front of expansion for many, many years as advocates tried to convince politicians to pass it, until it came to the point where advocates in Missouri took it to a ballot initiative, which not every state has that option, but in Missouri, there is the option to put issues to a direct vote of the public to determine whether or not to pass certain things. And so that's how Missouri got to where we got. It was an issue that in most states, it was taken up through the political process and passed either by the state legislature or implemented by the state governor. In Missouri, that option was not available, and so advocates took it directly to the voters.
You bring up a really good point, Sheldon. And so I'm curious if you can talk about the difference between whenever Medicaid is expanded by a state legislature or governor versus a ballot initiative. And so you had mentioned that Missouri is rather unique in the way that we approached it. So what are some of the differences there?
Well, so, very, very briefly, Missouri is now one of 6 states that have expanded Medicaid through a ballot initiative. It is an initiative that has passed in every state that has brought it to the voters. And so it's clearly an issue that is popular with most voters and has been passed in 6 states. At the end of the day, there really is no difference in the program in how states get there. At the end of the day, if you're in a Medicaid expansion state and you have income up to 138% of the federal poverty level, you'll qualify for Medicaid. I think if you talked to legislators, what they would tell you here in Missouri is that by bringing it to a vote of the people and the way the advocates and supporters of the bill chose to frame it, they made it not just an addition to Missouri's statutes, its laws, but they actually made it a part of the Missouri state constitution. And so by doing that, it actually gives the legislature a little less room to maneuver to make changes to what the voters voted on. And so it probably is a little peculiar to have an issue like this be embedded in the state constitution. But after 10 years of going the legislative route, that's what the advocates chose to do, and that's what eventually happened. But at the end of the day, for people who would be eligible for the program, that doesn't really make a difference. For them, what's important is that starting in July, their access to health insurance coverage will be greatly expanded.
You know, something that you just said that I kind of want to lift up a little more is thinking about the sheer number of people who had to be involved in getting this as a ballot initiative one, being able to have just the people power of getting the signatures in order to get it on the ballot, the people power of getting out and mobilizing voters and making sure that folks were registered to vote, that they knew where their polling location was. They knew that it was going to be on the August ballot. It's likely, I think, that many of those folks who mobilized and really pushed for this effort also fell into that coverage gap. And so I think that it is something really important for us just to consider the sheer number of people power and effort that had to go into this and how personal of an issue it is for many Missourians.
Yeah, I think that's absolutely right, and I would add that at least at the end of that campaign, all that happened during a pandemic as well, and so which obviously complicated it. I mean, a big part of any campaign, whether it's a political campaign for a candidate or an issue-based campaign like this, is meeting people and knocking on doors, and a lot of that was not able to be done in the last few months of the campaign because of the pandemic, but. I think the effort you speak of really speaks to the resonance that this issue has with people, not only in Missouri, but in all the states that have had to go through the ballot initiative process to implement it. It takes a tremendous amount of organization and effort and people hours on the ground and certainly money to wage a campaign like this and ultimately bring it to a vote and get 53% of Missouri voters to vote in favor of it. I don't think we should, we shouldn't lose sight of the fact that the reason Medicaid expansion did not make it through the legislative process was that Missouri is a pretty conservative state, has a very conservative legislature, that put roadblocks up to getting this done through the normal legislative process. And so the fact that there was enough support on the ground in the grassroots, um, and with all the organizations and all the people that worked very hard to get this passed, many of whom were directly affected by this, but not all of whom. I mean, I want to emphasize that this is an issue that really brings benefits to the state well beyond just the people who would be directly covered by health insurance coverage. One of the things, for example, that it does is that it brings our tax money back to the state from Washington, D.C. So everyone in Missouri is a federal taxpayer. We have been sending our money to Washington, D.C. to pay for this program, but we have not been accepting the money from DC to actually put it in place. And so billions of dollars will flow back into Missouri directly related to this program. That money does not only stay in the healthcare sector, that money spreads throughout the Missouri economy. It creates jobs, it creates business and growth, and really should benefit really every corner of the state and affect people positively who will never actually get touched by the fact that they may gain health insurance through this program. This is a program that, to give you another example of something that's an indirect benefit, kids are already covered, already have pretty good coverage under the Medicaid program in Missouri and are not directly affected by Medicaid expansion. Yet we know that Medicaid expansion improves the health of kids. And the way it does that is because it improves the health of their parents. And what happens with kids is obviously directly related to what's happening with their parents. And so it really has a lot of ripple effects throughout the state on people's health, on people's well-being in general, that go far beyond just the people who would be covered, although we should not minimize how important it is for the people who will be covered, because to go from a situation where you're uninsured and unable to take advantage of health services, or if you do need to go into the health system, to have to pay huge costs for that and possibly go bankrupt, to go from there to a situation where your health insurance is covered and your health needs can be taken care of, is a profound positive change in people's lives.
I really appreciate kind of the examples and the picture that you just painted. And as you were talking about it, it made me think about whenever I was doing direct service and working overnights in a shelter, and just reconnecting with all of the other advocates who are working in shelter, and thinking about, the way that it was before. Many of the individuals who might be coming in to receive services, a woman might have coverage while she's pregnant, and then her child would have coverage, but she's no longer going to have access to it. And we also know that with that connection to intimate partner violence, sexual violence, there can be really long-lasting negative health impacts that you might need to deal with for years to come. And so if you also add in another layer of living in one of Missouri's more rural communities where you don't have a lot of options for healthcare, you might be having to travel quite a distance to even have access to a physician. I think that the picture you painted really shows how those ripple effects of expansion can benefit Missourians. We
Yeah.
do have expanded coverage. We have expanded economic benefits for communities, and that's going to help all of Missouri. It's going to help our state in a number of ways.
Yeah, that's absolutely true. And I think that the most direct aspect of expansion is an expansion of health insurance coverage, which is vitally important, but by no means the only thing that has to happen for someone to have adequate access to healthcare. And so all those other factors that you mentioned, living in a rural community, for example, where there might be fewer doctors, the fact that more people now have coverage and more healthcare dollars are flowing into that community increases the chances that physicians and other healthcare providers would locate in that community. I mean, if you think about it um, from a very practical sense, where is a physician going to locate their practice? Where most of their patients have insurance and are more likely to be able to pay their bills or not. And so the communities that stand to benefit from this the most are those communities that perhaps have started with the least amount of resources and can see the biggest gains from something like Medicaid expansion.
Well, Sheldon, I want to jump back for a moment to something that we touched on briefly, but the fact that we are in a pandemic, right? Prior to March, whenever I would be recording with folks, we tended to do that in person. All of our recordings since then have been over Zoom. Many of us are figuring out exactly what it means to live and work in a pandemic. But something else that the pandemic has really exposed is just the many gaps in our healthcare system here in Missouri, as well as really exposing all of the vast health inequalities that Missourians are facing. So, can you talk a little bit about how the state can really ensure that the most vulnerable Missourians get that expanded access to care?
Yeah, those are great points, Matthew. And I think that what you're getting at is, okay, the ballot initiative has passed. Now what? Health insurance doesn't magically appear for 230,000 people that didn't have it, and they start going to the doctor or the hospital and getting their needs taken care of. There's a whole lot that needs to happen to make this work. And the ballot initiative actually directly addressed a couple of those things. And they get down to some of the real technical details of how the Medicaid program works. So, as I mentioned at the top of the broadcast, every state has its own Medicaid program. It is a partnership between states and the federal government, and so states. The federal government essentially holds states to a set of minimum requirements in their Medicaid programs, and then states have a lot of flexibility above and beyond that. But in order to implement the Medicaid expansion, a state has to submit documents to the federal government that the federal government will find satisfactory. And in the case of Missouri, the ballot initiative requires that those documents, which are called state plan amendments, be submitted by March 1st. The other date certain in the ballot initiative is that the implementation take effect and that people start being allowed to enroll in the program in July of 2021. And so from the ballot initiative passed in August, which meant that there was less than a year of lead time. Obviously now that's a shorter amount of time, and state agencies, including the Department of Senior Services, Social Services, is working on all the internal processes that need to be put in place for this to happen. So, if you think about it, um, the way a program like this works is there are eligibility requirements. Your income has to be at a certain level, and so the state has to have processes in place that can verify what people's incomes are, and those processes are going to need to expand to cover several 100,000 additional people who will be coming into this system. So there are IT needs internally in state government that need to take place. There are decisions that state government leaders need to make about things like the benefit package that will be offered to people in the Medicaid expansion. Will it be the same as the standard Medicaid benefit package? And if not, how will it be different? And if it's different, how will it meet federal requirements? And so all those things are ongoing internally to the state. A piece of all of this is there has to be a pretty robust effort to make people aware of the fact that this is now available to them. And so here in Missouri, as in other states, a huge grassroots infrastructure of people and organizations has been in place since the early days of the Affordable Care Act to help connect people to health insurance options. The folks who work in those jobs might go by various names: navigators, certified application counselors, assisters. They may work for social services organizations, for hospitals and other healthcare providers. They're all out there with the goal of connecting people to health insurance. And there will now be another health insurance option available for people. And so all of those connectors need to get information about the Medicaid program and how it works and how people can qualify for it and how they can connect people into those state systems to get them qualified and enrolled in the Medicaid program. I mean, one of the peculiar quirks of our system here in this country is that it's not enough to be eligible for a program. You have to actively enroll in it. And so there's a process people need to go through. And there is assistance out there to get them that help. But the state also has a responsibility to create a campaign that makes people aware of what's available for them. And so part of the state's preparations for this will be making people aware of what they're eligible for and how they can go about getting enrolled.
That's such a really good point that you bring up because there was a lot of people power that had to go into even getting this initiative passed on the ballot. But now there's a ton of people power that needs to go into educating Missourians about these options. And so I appreciate the way that you also tried to find that balance between the state has a lot of responsibilities in terms of building that infrastructure, getting our system ready to roll it out. And they also have a responsibility to communicate to the public how to actually access these options now too. And I think that that also reinforces something that you had said a moment ago of all the people who have to be involved, the people and the systems that have to really be reshaped and built for our state to really successfully implement this.
Yeah, I mean it's a huge effort. Missouri is doing it as the 38th state in the union to pass Medicaid expansion. So a lot of states have come before us, and we've learned a lot from them about how to do this. Every state that's done it has stayed in the program, and so has seen that it's worthwhile to bring this program to the folks that live in their states. And one thing I want to point out, the Parson administration certainly was opposed to the Medicaid expansion ballot initiative, but to their credit, since it passed, they have been moving forward, as far as we can tell, in a pretty expeditious fashion to get everything that's needed to be in place. And so I am really encouraged when I speak to people who work in the Missouri Medicaid program that they are moving forward with goodwill and good intent to do this. And there's a lot of people watching them. And so certainly all those people that worked very hard to get the ballot initiative passed are still engaged to the extent that they are keeping an eye on the administration to make sure it follows through on carrying out the will of the people. And we'll see what happens when the legislative session starts in January. There will undoubtedly be attempts in the legislature to try to make changes or roll back the program. And so that same energy and effort that was needed in the campaign is going to probably be needed come January in the General Assembly as we kind of navigate whatever some of the legislators might throw at us. But I think it's an important message that the Parson administration is sending by moving forward with this, and hopefully they are speaking with legislators and saying, look, this is something that the voters have passed and that we intend to do, and to do in the right way.
I'm going to echo that, and to do it the right way. I think something that you said a moment ago, that Missouri has now joined 38 other states that have passed Medicaid expansion. And of those 38 states, none of them have rolled back out of the program. So that's really highlighting the importance of getting it right for your state. And stealing a line from Missouri Foundation for Health, regardless of how you look at it, Medicaid expansion just makes sense.
Yeah, absolutely. I think that one of the things that's really interesting is you may recall in the summer of 2017, I'm sorry, in the summer of 2017, there was an effort in Congress to repeal the Affordable Care Act. And that effort, there were four separate bills that came up in Congress, ultimately that all failed. And one of the primary reasons they failed is that Republican governors were in Washington, D.C., lobbying their congressional representatives, saying Medicaid expansion is working for us. It is bringing dividends to our state. It is helping millions of people. You can't roll this back at this point. There were several very dramatic votes about that, and I just think it's really important to keep our eye on the ball and to remind Missouri legislators who may be still eyeing this with some trepidation or some question that Medicaid expansion is something that has been remarkably successful across the country, is supported by Democrats and Republicans alike, conservatives and liberals, and some of its biggest supporters are Republican governors. And that should be testament enough to how important this program is and will be for the state of Missouri.
Absolutely. Well, I want to turn focus back around on the foundation just for a minute, because I know that MFH is in the process of really looking at how the foundation can transform Missouri's public health system. So I'm curious, Sheldon, from your perspective, how do you think Medicaid expansion can really transform Missouri's public health system?
Yeah, that's a great question, and I think it kind of gets to a little bit of the disconnect in our health system and the way it's set up. And certainly the pandemic has shown a really bright light on all the inequities in our health care system. But it has also shown a pretty bright light in how unprepared we were in the public health system to deal with this. And I make that distinction because healthcare and public health are literally two different systems with two different methods of funding. And most people are certainly very aware of the healthcare system. They're aware of how, they're aware that they need health insurance. They're aware of who their doctors and hospitals are, but public health operates in the background, and people are not aware of what's going on in public health until something goes wrong like this. And public health is a system that is largely dependent on government funding to operate. So whereas healthcare, there is a lot of government money that goes into it, but there's a lot of private money that goes into it as well. Certainly our employers are putting a lot of money into health insurance. We are paying a lot of money out of pocket for insurance premiums and for healthcare. Public health, the folks who work in the local public health agencies in every county in Missouri, the folks who are responsible for immunizing our kids against various diseases, the folks who are responsible for clean water and clean air, and making sure that restaurants are safe to eat at. Those are the public health folks that are reliant on our tax dollars for their funding. And Missouri does not do a very good job of funding those services. We are 50th out of 50 states in per capita funding for public health services. And I think that what we're seeing in this pandemic, which has certainly been a disaster throughout the country, but particularly so in a state like Missouri, where our public health system, especially in the smaller rural counties, was just not prepared to deal with what we're up against in terms of testing, in terms of contact tracing, and in terms of just keeping the public safe from this deadly virus. And we are going to have an opportunity moving forward. To have certainly an awareness of public health and the public health system is at a level that it probably has never been at before in the public, and amongst legislators. And hopefully we'll be taking a really close look at our response to this pandemic, what's worked, what hasn't worked, and the foundation is doing a lot of work in that area to try to assess how we've come through this, and we will have a lot of opportunities identified for how we can do better for the next one. And I would hope that folks stay engaged and interested in this, because it's an issue that deals with public funding, and so the only way it stays on the radar and gets attention and make sure it gets the adequate funding it needs is if for people on the ground to continue to pay attention to it. And we have an opportunity for my friends who work in public health. This certainly is, nobody has ever wished that a pandemic like this would happen, but it also gives us a real opportunity to shine a light on how important our public health system is, and frankly how neglected it's been over the years, and that we really need to do a better job to build this up. I mean, we put an enormous amount of money, more money than any other country in the world by far, into our healthcare system, and it still has enormous gaps. And public health has been kind of left in neglect, and we really need to refocus on it and relook at how to better fund it and how to do our jobs better in protecting the public's health.
Well, you have the attention and ear of advocates on the ground at our 120 plus member agencies across Missouri. So Sheldon, from your perspective on that, how do you see the role of domestic and sexual violence agencies really working to help build that public health infrastructure here in Missouri?
Well, I think, first and foremost, the role of the organizations you work with needs to be directly in working with the clients they work with. I mean, that's job number one. There are people in crisis who need the help that the agencies offer, and that needs to always be the focus. Beyond that, it's important that people have access to the services they need. And those services involve healthcare services, which include mental and behavioral health services. We shouldn't forget that. Again, we make this strange distinction of thinking of the physical health as different from mental health, and that's one of the reasons why I think we have a little bit of a disconnect, and that our mental health system is not fully funded in the way it ought to be, but your agencies are certainly on the front lines of that fight as well. But I think we also need to expand our awareness beyond just health care and think of public health, and the fact that if we did a better job of protecting the health and safety of people upstream, we probably wouldn't need to spend as much in healthcare as we do. And so that's something that I think all advocates need to keep in the back of their mind. You're gonna do your day-to-day job as your first priority, but we all need to be pulling our oars in the same direction on these bigger community-wide issues, and making sure people are able to have access to the services they need and have those protections in place that we all just really count on. That include things like clean air and clean water, the things that are really the fundamental building blocks of public health.
Yeah, I mean, I couldn't agree with you more. As someone who is really vocal about being a public health nerd, I've really enjoyed having this conversation with you. And I think it's so important that as we move forward in building Missouri's public health infrastructure, we do have to take that really holistic approach. So not only thinking about people's physical health, but mental and behavioral health, just as you were saying, thinking about the intersection of housing security and food security, just as you were saying as well, making sure that people have access to clean water, to fresh air, to livable streets and community spaces that build community. Um, I think that that's such a really important aspect of this. And while there's a lot of excitement and momentum to have us move forward with Medicaid expansion, that is one piece of the much larger puzzle of building that really strong and comprehensive public health infrastructure for our state.
Yeah, absolutely. I mean, when we were talking before the podcast started, I told you a little bit about my history. So, I mean, I've been working in health policy for more than 30 years, and have spent much of the past 10 years focused on Medicaid expansion, first in the state of Kansas and then here in the state of Missouri. And I can honestly say that there probably is not another issue I've worked on in my career that will have as much of a profound effect on health and welfare of people in the state as Medicaid expansion. But that said, um, the pandemic has shown a light on how we need to not forget about public health and remember its important role in all of this. And without a strong public health infrastructure, all the healthcare in the world down the road won't make any difference. And so um, I certainly hope that if we've learned nothing else from this pandemic, it's that public health is really foundational, and that our legislators need to take it more seriously in the future than they have in the past.
Couldn't agree with you more on that statement. Couldn't agree with you more, Sheldon.
Good. Well, it's been a pleasure to talk to you, Matthew.
Yeah, it's been really great to have you on this episode, and I really appreciate you taking time to chat with me today. You know, I always like to end each episode with kind of a lighthearted question that isn't exactly related, but is still kind of topical. And so it is November after all, and many of us are thinking about how we'll celebrate the Thanksgiving holiday in a safe way of our own. But the really important question for me is, what is your favorite Thanksgiving dessert?
Well, that's a really good question. Thanksgiving is one of my favorite holidays because I love all the food. But when it comes to dessert, it doesn't matter whether it's Thanksgiving or any other time of year. I'm always going for ice cream. so, so
Yeah,
pumpkin pie, apple pie, all that stuff is great, but ice cream's number one.
number one for you. Well, that's consistent then because you can enjoy it year round.
Absolutely, absolutely. It's never too cold.
All right. Well, thanks so much, Sheldon. Again, I really appreciate you being on the episode with us this month.
Thank you. It's been a pleasure to talk about it. Medicaid expansion is near and dear to my heart, so it's been a pleasure to be with you. Thanks.
Excellent. Well, thank you for being our partner in this work.
All right, good.